Welcome Professor Kilpatrick and classmates to my Research Capstone Project presentation. My name is Elizabeth Morgan. I am a student at San Diego Christian College studying Human Services. I have done an ethnographic research on drug and alcohol addiction treatment programs for women. Drug and alcohol addiction is a serious disease that afflicts more and more women. The purpose of this study was to determine the best treatment program for women who suffer from a drug and alcohol addiction. Specifically, which two types of programs, either a long or short-term treatment program, will meet her needs for a lifelong of sobriety. What is alcohol use disorder, also known as AUD, and substance use disorder, also known as SUD? Research has shown that alcohol and substance use disorder occurs in different forms of severity, from mild misuse to problem use to dependence and eventually to addiction, the worst form of AUD and SUD. If we take a look at addiction through scientific lenses, evidence and research show addiction is a chronic disease that makes changes to the reward circuit portion of the brain. The National Institute of Drug Abuse defines addiction as a chronic relapsing brain disease that is characterized by compulsive drug seeking and use despite the harmful circumstances. This slide chart shows the saliency of drug and alcohol in the brain of a non-addict and an addict person. Often without knowing the consequences, a person first tries alcohol or drug as a voluntary choice. At some point during the use, a switch gets flipped within the brain, and the decision to use is no longer voluntary. As the director of the National Institute of Drug Abuse puts it, their brains have been hijacked. Addiction is a chronic and relapsing condition, much like diabetes, cancer, heart disease, and asthma. Addiction is preventable, treatable, and changes the physical and chemical structures of the brain. As you can see here in the brain scan, if left untreated, it can last a lifetime and end in death. Many of the women in my research follow the recovery cycle. Women can feel helpless if treatment is not immediately available or readily accessible when they recognize the devastating effects of their addiction in their lives. As with other chronic diseases, the earlier the treatment is offered in the disease process, the greater the likelihood of positive outcomes. There are approved forms of addiction. It appears face-to-face communication has been replaced by electronics. As we look at the right diagram, our moods, emotions can trigger and alter brain signals, and before we know it, we could have a food addiction. How many of us have this stereotypic image of a woman who's an addict, otherwise known women of the streets? They have frequent encounters with criminal justice systems. But this isn't always the case. I want you to imagine a young mother who as a child she was abused, physically, mentally, emotionally, and or sexually. She was threatened by her abuser not to tell anyone. She grows up feeling she has done something wrong and never has dealt with her inner pain. She is looking for something that will dull that pain. She turns to alcohol, marijuana, and other drugs such as heroin. Now imagine a middle-aged woman who was a nurse at your doctor's office, who may have helped deliver your children, or has helped with your own medical needs. She was in a car accident. She suffered back and leg injuries, was prescribed painkillers. She continues to take the painkillers even though her injuries are healed. Before she realizes it, she has become addicted, and eventually her addiction leads to broken relationships. Once her attempt at getting more prescription painkillers fails, she looks for other ways to support her addiction. Heroin is cheaper and provides a similar high. In both of these situations, the outcome is not good. They each have resulted in addiction. This slide is about a young woman named Allison who shares the truth of the cycle of addiction. She states, from the first day of using, she never stopped using. Within a week, she was snorting heroin to shooting it up. Within 1 month, completely addicted, she lost everything, her car, her home, and is in debt. She has lied, stole, cheated, and the result, she was raped, beaten, mugged, and arrested. At that point, death felt better than the life as a junkie. Although there are many unfortunate factors that may cause a woman to fall into drug and alcohol addiction, thankfully there are many drug and alcohol addiction treatment programs to save these women's lives. They help families with intervention, then getting them detoxed, finding a treatment plan. They have one-on-one and group therapy sessions. There's outpatient and inpatient short-term programs and long-term recovery programs, and some offer aftercare programs. With so many to choose, which one is the best? Like any disease, addiction has to be individualized treatment depending upon the drug and the individual needs. I was able to go into 4 local recovery addiction treatment programs: the YWCA in South Bend, the Bowen Center in Syracuse, which were short-term treatment programs. I also went into the Rose Home North and the Spa Women's Ministry long-term program. I had 16 women participate in my survey. Addiction versus recovery. Women who suffer from addictions may have a me mentality, but women in recovery, they start having a servant heart to help others and realize they need the help of their higher power God and others in recovery. In my study, the next slide shows the most common use. They were cigarettes, alcohol, marijuana, stimulants such as cocaine, methamphetamine, and Adderall. Depressants they used were Xanax, Klonopin, and Valium. The opiates were Oxycontin, Vicodin, Percocet, and heroin. These were the most common drugs, including alcohol, among all ages. The next slide graph shows 69% of the women had a common addiction to cigarettes and methamphetamine. 63% had alcohol, 44% used opiate and marijuana, and the least common was depressants at 38%. Here are some of the reasons why women use drugs. It appeared that 88% of the women self-medicated themselves with drug and alcohol. 69% used drug and or alcohol to deal with problems and depression. 63% were addicted. tied at 56% stated they used to get through their day, and they also because they were angry. As you can see here, 88% participated had been using drugs for 5 to 10 years. Most common statements was, "I continued to use because I couldn't handle the withdrawal symptoms." Many times if a person goes through withdrawal, they will continue on the insanity cycle, taking drug and alcohol to relieve withdrawal symptoms. Staff noted that it is best to have a person go through a detox program and receive medical treatment prior to going into a recovery treatment program. It is important to get to the root of why women are abusing alcohol and drugs. Relapse of drug and alcohol abuse does not indicate failure. Rather, it signifies that treatment needs to be reinstated or adjusted. Alternate treatment may be needed so women can return to their everyday life and help them become productive citizens in their communities. As you can see here, 69% of the women felt a long-term program would be best meet the needs of a life of sobriety. 38% of the women participated in a long-term residential recovery program, along with a short-term program at the local Bowen Center Mental Health, which included drug and alcohol addiction treatment programs, moral recognition therapy, intensive outpatient programs, and one-on-one counseling. By asking and addressing the women's co-occurring symptoms, this will hopefully allow them to be properly medicated so they don't self-medicate themselves inappropriately. It appears 44% of the women abusing drug and/or alcohol have co-occurring symptoms. The data I gather will work with helping women with drug and alcohol addiction, and those working with them help them understand why, when, and what caused the women to start abusing drugs and/or alcohol. Knowing this, they can develop a safety action plan and relapse prevention plan. Each woman has individual special needs that require an individualized treatment program. This is an example of a token they receive from completing a program. Those women participate in 12-step programs such as NA, AA, and Celebrate Recovery will receive a similar token or keychain with the program's emblem and how many months they have been sober. This is a happy moment for them. Regardless of what the setting, a short or long-term addiction treatment program, women need drug and alcohol education. They need to learn boundaries, problem-solving tools, assertiveness, and parent training. Some of them may need family and individual therapy to help them deal with depression, anger management, to learn to have self-esteem, and educational tools. The earlier, the better. This verse from 2 Timothy 1:7 states, "For God didn't give us the spirit of fear, but of a power, of love, and a sound mind." For myself, I need to do more research helping women with addictions and find healthy resources to help them with feelings of helplessness. My final thought: it doesn't appear to be one specific magical treatment program that is appropriate for everyone. Treatment programs need to vary depending upon the type of drug and alcohol addiction, along with the characteristics of the woman. I want to thank San Diego Christian College and the professors like Professor Kilpatrick who have taken the time teaching me valuable life skills. I know to be a successful servant of God, I will need to put God first in my life. With God's guidance, my journey through life, I will find balance in all areas of my life. I will be able to focus on life skills such as time management. I can set short and long-term goals. I can be a leader. I can help other women learn who their higher power God is and find a purpose and learn how to have a servant heart. Meditations, devotions, and journaling have helped my personal relationship grow with God. It not only grew, but I learned how unique God designed me so I can fulfill His purpose in my life. I want to thank each of you for taking the time to support me by watching my presentation. Best wishes to everyone, and God bless.